Hello, I'm Dr. Mark Dailey, and I want to thank you for allowing me to be part of your fibromyalgia group. After working with fibromyalgia patients for well over 10 years, I want to share some of my insights with the group as a whole. And I really want to be clear that what I share on this video is not intended to take the place of your primary care physician's instructions. That, of course, is between you and the doctor. Though I plan to share individual strategies to help reduce the symptoms of fibromyalgia, I believe in most cases there is not one single cure for fibromyalgia. In my experience, fibromyalgia is a multi-system breakdown, which means it involves the gastrointestinal system, the immune system, the endocrine system, and of course the nervous system, which includes the brain. That doesn't mean that fibromyalgia can't be defeated, don't get me wrong. But there has to be a strategy to pull all these things together. So the last thing I want to do is pretend that there is a magic pill for fibromyalgia. It's simply not the case. One thing I also want to mention before I get to our topic is that it would be foolish to expect to recover from fibromyalgia without making changes. Your body is fighting to recover health, but without you making changes, it's just not going to happen. You as a fibromyalgia sufferer actually have a lot more power than you're aware of. Most of you on this forum are hungry and eager to learn how you can defeat fibromyalgia and get your life back. And I don't want you to lose that. I don't want you to give up. But practical application is the way you're going to make changes. So those changes may be the way you eat, the way you deal with stress, exercising or not exercising, certain supplements that you might take, restriction of particular foods that you may actually have sensitivities to. Today, we're going to talk about magnesium and its influence on inflammation. Inflammation is the activation of the immune system in response to infection, irritation, or injury. It's characterized by an influx of white blood cells, redness, heat, swelling, pain, and dysfunction of the organs involved. Inflammation has different names when it appears in different parts of the body. Itis means inflammation. You've heard the term probably bursitis, right? Bursitis, it means inflammation of the bursa, which is a sac. It's a fluid-filled sac in your joints. Basically, it's a cushion. You've heard the term appendicitis. That's inflammation of your appendix. Now, if your doctor says, ma'am, you have bursitis in your shoulder, that simply means the bursa is inflamed. The diagnosis of bursitis itself doesn't reveal the trigger. In other words, what actually caused the inflammatory process. For that information, you have to dig a little deeper in a patient history, and that's especially true for fibromyalgia patients. The primary objective of acute inflammation is to localize and eradicate the irritant and repair the surrounding tissues, but this is completely different for a chronic low-grade inflammatory state, which for fibromyalgia patients is often the case. Now, it is magnesium that modulates this cellular events or these cellular events that involve the inflammatory process. There are many aggravating factors, or there are many what I like to call triggers, many things that trigger inflammation. They're found in both our internal environment, like inside of our bodies, and our external environment, and they include things like excessive hormones like insulin, emotional stress, which comes from the outside in or the way we perceive what's going on outside, free radical damage, viral, bacterial, fungal, including yeast, and other pathogenic infections, obesity, overconsumption of hydrogenated oils, which are bad oils, periodontal disease, radiation exposure, smoking, and certain pharmaceutical drugs. Now, these triggers are vital to understand for the fibromyalgia patient. Every fibromyalgia patient has hidden triggers that cause flare-ups. That's why most patients have good and bad days. You have to get this. There is no substitute for finding and removing triggers. So we're back to the fact that there is no magic pill. But there are common denominators of all these triggers, and inflammation is one of those. So if we can reduce your overall or systemic inflammation, we can reduce pain, we can reduce stiffness, fatigue, and even brain fog. So I'm not talking about a cure, I'm talking about a reduction. Magnesium deficiencies magnesium deficiencies actually cause and underpin this chronic inflammatory process. The concept is intriguing because it suggests a fundamental, simpler way of warding off serious diseases. Instead of different treatments for heart disease, Alzheimer's, and colon cancer and fibromyalgia, we apply a single inflammatory reducing remedy that could prevent or treat deadly conditions or serious chronic inflammatory processes like fibromyalgia. Inflammation and systemic stress are central attributes of many pathological conditions, including fibromyalgia. In magnesium, we have found a potent medicinal that is effective across a wide range of pathologies. Now, chronically inflamed tissue continues to generate a signal that attracts something called leukocytes from the bloodstream. When leukocytes migrate from the bloodstream into the tissue, they amplify the inflammatory process. So it's like an amplifier turning up the pain pathways, turning up your level of pain. And magnesium literally has the potential of putting a chill, if you will, on the inflammatory process. Unfortunately, there are many different kinds of magnesium. Some are more appropriate for the fibromyalgia patient than others. To make it easy on you, I recommend magnesium that is called magnesium malate for fibromyalgia, because it not only has the potential of reducing inflammation, but in this form it also can increase your energy and reduce fatigue. And I know for my fibromyalgia patients, this has worked out very, very well. I will leave a link somewhere here, either in the text or perhaps on the video, to show you what I would recommend. Keep in mind that when you buy a supplement, you really want to get pharmaceutical grade. That means it really has what they're advertising. Anything otherwise, you're really taking a risk. One of the best that I've seen is made by Douglas Laboratories. You might make a note of that, Douglas Laboratories. I'll leave a link to that below. But thank you. Oh, something that you need to know as well, if you take too much magnesium, it can cause loose stool. So you can modulate that. Really, I'm thinking about 600 milligrams a day. You might be able to get up to 1,000 milligrams a day. So the only downside is if you start to see your bowels getting loose, then you just need to back off a little bit, wait for you to stabilize, and then continue trying to get up to at least 600 milligrams a day. It also acts as a muscle relaxer and helps you sleep. So you might want to take that at night before bed. But thank you so much for your time and your attention. God bless you. I wish you the very best of health.